Hello and welcome to NHIS in a week. Here we give you highlights and happenings in the authority and beyond. My name is Lydia Efiatrema Obusu. Now the headlines. Private health insurance calls for reform. Ghana's NHIS success attracts Nigeria Health Watch. And NHIA Central Regional Director engages district. The news now in detail. Private health insurance providers are pushing for major reforms, including a proposal to make private health insurance mandatory for corporate Ghana. They say this would improve access to quality healthcare and promote sustainability in the sector.
At a high-level meeting with NHI CEO Dr. Victor Asare-Bampo, the president of the Private Health Insurance Association, Ronald Opon-Adom, advocated for a review of the 150% capital adequacy ratio, calling it burdensome compared to regional benchmarks. He emphasized linking private health insurance digital platforms with the NHIS database to enable integrated services.
In ensuring a transparent provider back end, it would be useful for NHIA to allow private health insurance players to connect our platform, because we equally also have a platform, so that if the two platforms can't communicate, it will ensure that we are even able to provide a joint product to the Ghanaian populace, which as NHIS as the base and private health insurance as some top up to that initiative.
The managing director of Acacia Health Insurance, Dr. Mo, stressed the importance of standardized data to better understand market needs. In response, NHI CEO Dr. Bampo welcomed the proposals and pledged deeper collaboration.
I really appreciate the fact that you found time to come. I can assure you that in the vision that the president has for the country, the resetting and the parts that we play, you are a critical partner, so we'll do as much as we can to make sure that we collaborate with you.
Director of Private Health Insurance Scheme, Alhaji Hudu Issa, acknowledged the concerns and indicated that adjustments to the capital adequacy ratio are under consideration. NHI's Acting Director for Corporate Affairs, Mr. Oswald Ishiamensa, highlighted the importance of dual membership systems to support policy implementation. The discussions focused on sustainability, digital integration, and the shared goal of achieving universal health coverage.
Also in other news, Ghana's success with the National Health Insurance Scheme has attracted international attention. The CEO, Dr. Bampo, shared the country's transformation story in an exclusive interview with Nigeria Health Watch.
Speaking from Accra, Dr. Victor Asare-Bampo outlined his vision for the NHIS, improved internal controls and staff welfare, eliminated illegal charges, and better delivery of government health initiatives. He praised President John Dramani Maham's decision to uncap the NHIS levy, describing it as a game changer that ensures timely reimbursement to health providers.
When His Excellency the President was campaigning to come into office, he promised that something that the previous government had done, which was to cap the levy, he said he was going to remove the levy, and he has done that, which means that all the funding that is coming nominally to the health insurance fund is actually released to the fund. Previously, what was happening was that some of it was being taken away. So that's an important thing that the president has done.
Dr. Bampo reaffirmed Ghana's commitment to achieving universal health coverage centered on geographical access, service delivery, and financial protection. He highlighted two flagship policies, free primary healthcare and the Ghana Medical Trust Fund, popularly known as Mahama Cares, which aim to close access gaps for chronic diseases.
Two things. Number one, and they're at both ends. I like to describe them as being at both ends. One is actually free universal primary health care, which means that if you are a Ghanaian, wherever you are, in whichever region, at whatever time, you can actually go for a basic minimum package of primary healthcare services free of charge. The second is what we call Mahama Cares, which is named after the president. And this is an innovative private-public partnership that is going to ensure that people who suffer from non-communicable diseases like cancer, like end-stage renal failure, like diabetes, hypertension, and its effects like stroke, will have, and this will be targeted for certain people, who are in society who cannot pay for these services. They will be given the financial wherewithal to be able to access healthcare.
Digitizing claims processes and using mobile technology for enrollment are also part of reforms to make the NHIS more efficient and responsive.
Now moving to the Central Region, the NHIS Acting Regional Director, Mr. Kojo Setre Thompson, has embarked on a working tour of 3 district offices to assess the operation and motivate staff.
The tour took Mr. Thompson and his team to the Abra Asebu Kwamen Kese, Asen South and Asen North district offices. He engaged directly with frontline workers, emphasizing teamwork and dedication to increasing active membership of the scheme. Mr. Thompson also visited some credentialed health facilities and discussed key issues such as claims reimbursement, service quality, and the fight against illegal co-payments. He commended the Central Regional Health Director, Dr. Alberta Brichum-Nyakum, for her consistent support in growing the scheme.
Now, the Acting Regional Director of the National Health Insurance Authority in the Oti region, Mr. Julius Nilemo, has begun a regional tour to deepen stakeholder engagement and understand the operational challenges they face.
Mr. Nilemo's tour included visit to the Jasika NHIA office, Guan District Health Directorate, Oti Regional Health Directorate, and Rara Government Hospital. He discussed the NHI's new enforcement actions against co-payment practices and reiterated reforms under Dr. Bampo's leadership. Other topics included boosting NHI's membership, improving service delivery, and fostering closer partnerships with healthcare providers. The visit reflects NHI's commitment to strengthening regional structures and ensuring equitable access to health insurance services. His district and regional team members joined Mr. Nelimo during the tour.
And finally, as the rains continues, NHI is here to guide you with simple health tips to stay safe and prevent diseases. Listen closely to this week's NHI's rainy season message.
As we enter the rainy season, NHIS reminds all members to take steps to stay healthy. Sleep under insecticide-treated mosquito nets, drain stagnant water, and seek early treatment if you feel unwell. Together, let's fight against malaria and any other rainy season diseases.
Jimmy Ruffo, I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Now here is a recap of this week's edition of NHIS in a Week. For more stories, kindly log on to our website www.nhia.gov.gh. You can also visit any of the social media platforms displayed on your screen. Thanks for watching.